examination of the mouth and the throat. You stand in front of the patient and you do the examination of the mouth using the pen light and a spatula. We're first going to start at the corners of the mouth. We look if the corners of the mouth are healthy. We also look at the color of the lips. If the lips is moist and no dryness, and there's no sores or any lesions on the lips. We also look at, open the mouth, and we look at the buccal mucosa to see if there's any abnormalities. We look at the teeth and the gums. We look at the gums. We look on the dorsum of the tongue, and we look on the underside of the tongue. We also look at the throat, the tonsillar pillars and the tonsils, including the hard palates and the soft palates, especially the uvula. We check and see if there's any abnormalities. For example, on the buccal mucosa, if there is any, on the buccal mucosa, for any swelling or sores or lesions. At the gums, we look for any anemia, gingivitis. We look at the teeth for any discoloration, poor hygiene, caries or abscesses. We look at the tongue, especially at the color of the tongue. We look at the color of the tongue to see if there's any pallor, or we look at the underside of the tongue to see, especially by the frenulum, if there's no ulceration or any swelling. We also look at the palate. Hard palate, the soft palate, as I've already mentioned, if there's any infection or any trauma to the palate. We look at the throat, especially the postpharyngeal wall, to see if there is any swelling or any redness. We look at the tonsils and see if there's any enlargement of the tonsils and any redness around the tonsillar pillars. Also, when we look at the pharyngeal wall at the back, we look at the pharyngeal wall. We look at the pharyngeal wall to see if there's any infection. Right. And if there is any abnormalities, you can make use of a glove to palpate it and feel if there's any tenderness and pain in the mouth. So you use a glove and you put your hand inside the mouth and you palpate your site or your lesion that you want to palpate. And that concludes the examination of the mouth and throat.